Good morning. Good morning, everyone. I'm Peter Ainsworth. I chair the Heritage Alliance, and it's a huge pleasure to welcome you all to the launch of our report on heritage health and well-being. Thank you so much for joining. It's impossible for me to tell how many of you there are, but I'm told that there are an awful lot of you, which is fantastic. We're all a bit nervous about the technology, but we're delighted you're here, and we hope it works. We hope you find it useful and interesting. The last 6 months have been incredibly difficult for everyone, it goes without saying, for our friends, for our families, and not just for the economy, but for the economy also. And many of our organisations have continued to face real problems, still do. And we've kind of scratched our heads with our growing hair and rubbed our chins with our beards and wondered how we're going to survive at all. I think we all should, in fact, ask another question. I always try to do this, which is, why do we deserve to survive? Nobody has a kind of right to do so, and everything needs to be justified, especially when the government is being generous and the lottery is being generous with public money. So why heritage? And I think the report we're doing today provides an incredibly powerful answer to that question. There are others, but this is one. Because as well as learning about the difficulties of coping with this situation, we've also learned that physical health and mental health are absolutely essential. And this sector, we deliver escape, hope, and happiness. We provide local parks. We offer peaceful and beautiful landscapes. We offer uplifting things, thought-provoking places and objects, and a chance for reflection. And we've also been able to innovate through this at the Alliance, but also throughout the sector, thanks to support from the National Lottery Heritage Fund. We're acting to enable much greater participation through new digital technologies, which, as we're all discovering, are absolutely essential these days. It's, I guess, a bit ironic that lockdown has illustrated how vitally important our environment is, both natural and built, how vital that is to our sense of happiness, our sense of place, our sense of belonging. And we can offer a positive and life-changing, affirmative set of experiences at a time of great stress and anxiety. So the report we are launching today showcases many ways in which heritage organisations can improve communities and the health and the happiness of people. It offers recommendations. I commend our recommendations to you. They're based on things that have worked, that are working. Working to achieve more inclusive, more diverse, more life-enhancing experiences. Yet again, our sector can demonstrate that heritage isn't just about old stuff. We can transform lives. We have a power which can be transformative. And heritage, access to beauty and creativity, an understanding of history, of times past, good and bad, is not exclusive, whatever our cultural histories may be. We could all do with cheering up. Access to heritage can lift our eyes and our hearts. So it'd be great if you could, after this, think about how your organisation might respond to some of the recommendations which we put into this report. I gather we have people here from the health sector today. You are very welcome indeed. Thank you for joining us. And I'm not saying that, the heritage industry or sector can solve every problem under the sun, but I really do think, and I hope most of you will share this, that we perform a public good. It's not just a nice to have thing. It's a real public good as well. Finally, from me, huge thanks to Wessex Archaeology. Giles Woodhouse from Wessex Archaeology is carrying much of the burden of what comes later in this event. And thank you, Giles, for that. And to Lilley Architects, who are sponsoring this report. Also, a repeated thanks really to Ecclesiastical Insurance, who sponsored the original heritage debate from which this session evolved and have been very loyal and helpful supporters to our sector over the years. Thanks to all who contributed to the report and those who wrote it. We at the Alliance think we have a brilliant team. In fact, I know we do. But in the end, we're only as good as our members, and we owe everything. We owe everything to you. We also owe a great deal to our minister, Nigel Huddleston, who I'm delighted to say is about to join us. He's proved to be a very good friend of the heritage industry, and the additional money going into the culture, media and sport sponsored sectors has not gone unnoticed by those who are at the receiving end of it. Thank you very much indeed. So, without further ado, let me hand over to Nigel Huddleston, the Minister, and then put you at the tender mercy of Giles Woodhouse for the rest of the session this morning. Thank you very much indeed, and thank you for joining us.
Well, thank you, Peter. Hopefully you can hear me okay. And assuming that's the case, I will start now. And well, first of all, good morning, everybody. It's fantastic to join you today. And I would like to start by extending my thanks to the Heritage Alliance for inviting me to speak today. It's truly great to have the opportunity to address so many of you who have been keeping our heritage sector running over the last few months. I think there's more than 200 on this call. And I'd like to take the chance to say a huge thank you for everything you've been doing in these extremely challenging circumstances to protect our heritage. Your efforts will obviously enable people up and down the country to continue to enjoy the UK's magnificent historic sites, both in the immediate post-pandemic world and into the future. And so onto the topic of this morning's event, heritage, health and well-being. I can't think of a more appropriate time for a report like this to be published. The events of 2020 have thrown into sharp relief the importance of culture to the well-being of the nation. Our history and our heritage provides a sense of place and identity for individuals and communities. And the need for this has been absolutely amplified by the feeling of isolation felt by so many during the pandemic. So when the UK went into lockdown in March, people flocked to their historic parks to seek fresh air and exercise. And as the restrictions began to lift over the summer, visits to heritage sites were among the first priorities for many, including myself, often providing the settings for reunions with friends and family. Indeed, the Taking Part survey, published this month, showed that spending time with family and friends is one of the most common reasons given for visiting a heritage site at 46%. The restorative power of heritage has been truly brought to the fore during the pandemic, and I look forward to hearing the results of the Places of Joy, the Role of Heritage After Lockdown project, which I know has been looking specifically at this effect. Now, there has obviously been increased recognition of the importance of looking after our mental health in recent years, and the Heritage, Health and Wellbeing report clearly demonstrates that solutions don't always lie in pharmaceutical treatments. The many different projects, initiatives and approaches described in the case studies show the breadth of non-pharmaceutical interventions that can be used very effectively to address mental ill health, as well as to seek its prevention. Now, I was particularly interested to read about the work that's been taking place with veterans in the Operation Nightingale, the Breaking Ground Heritage, and the Waterloo Uncovered project. Now, for individuals who've been through one of the most traumatic experiences that a human can go through, to channel their energies into important archaeological excavations and to begin to recover whilst doing so is a true testament to the importance of projects like this. It's also good to see projects aimed at involving and supporting those with different needs, such as Alexandra Palace's Ribbon Stick Club Nights run by and for people with disabilities, and Historic Royal Palace's Sensory Palaces sessions for people with dementia and their carers. Now, heritage should be inclusive to all in society, and we must ensure that disability is not a barrier to participation in heritage. The report also successfully highlights the benefits of using heritage sites as a backdrop to physical activity, from fireside yoga at Powderham Castle to park runs at Hotham Hall, or getting your hands dirty at the Riverside River Canal and River Trust project. These projects all combine the proven benefits of physical activity with the mental health and social benefits of engaging with heritage. The Ringing Remembers bell ringing projects sounds by far the most strenuous of these, so kudos to the nearly 3,000 volunteers who signed up to perpetuate this most British tradition. And whilst the pandemic has undoubtedly brought struggles and challenges for us all, it's also fostered an enormous sense of community across the country. From the hundreds of thousands of people who signed up to the NHS COVID volunteer responder scheme, to those checking on elderly neighbours, delivering food, and so on, engendering and enhancing individual and community well-being has become a far greater priority for all of us over the last few months. This sense of community pride is already showcased annually in the heritage sector with the hugely successful Heritage Open Days every September. Organising over 5,000 events and more than 50,000 volunteers is no mean feat, but the benefits to participants clearly speak for themselves. As I'm sure that many in this virtual room know, nearly 70% of the volunteers at Heritage Open Days report feeling more relaxed afterwards, with 64% also feeling more active and healthier. And that's to say nothing of the role the Open Days provide in promoting and raising the profile of heritage sites and activities within the millions of attendees and the £20 million that this festival contributes to local economies. This is something of which the heritage sector should be truly proud, and long may the Heritage Open Days continue. Now, COVID has forced us to find new and different ways to connect with each other and with our environment this year, which has often involved using digital tools to create virtual experiences. And through their digital response, such as their Moment of Calm project, Wessex Archaeology have provided key opportunities for people stuck at home during lockdown to continue to engage with our beautiful heritage landscapes and historic sites. This is really encouraging, and I hope that more organisations will seek to utilise virtual experiences to enable even more people to enjoy the UK's heritage. Now, I know that the National Lottery Heritage Fund is also doing some great work to support the sector as it seeks to increase its digital skills and capacity, and I've seen some great innovations over the last few weeks. Now, I'd love to be able to stay and hear more details about some of the projects and what looks like to be an incredibly interesting agenda. Unfortunately, my diary commitments today don't allow this, but I do look forward to getting a full readout from my officials. And again, I'd like to extend my congratulations to Lizzie and her colleagues at Heritage Alliance for producing this fantastic and thought-provoking report. Huge credit must also go to Wessex Archaeology, and in particular to today's chairs, Giles Woodhouse, who I understand has worked tirelessly for the last few months to guide and finesse the production of this report. Thank you all for your work on this, and I hope the rest of the day goes very well indeed. Sorry I can't join you for the rest of it, but thank you so much for inviting me. And again, from the bottom of my heart, thank you for everything that you're all doing for the vitally important heritage sector. Thank you.
Next slide, please. I'd like to reiterate Peter's welcome to you all to this launch event and to say a warm thank you to Nigel Huddestone, Minister for Sport, Heritage and Tourism, for his time today. Your words of thanks and support to those in the heritage sector responding to the COVID-19 crisis is much appreciated. Moreover, your endorsement of the value of the Heritage Health and Wellbeing report and recognition of the contribution Alliance members are making is very welcome. As mentioned in his speech, the Minister must leave early, so we'll be unable to take questions. But attendees, please add questions to the Q&A chat box for the other panellists at the end. If you could include your name and organisation when doing so, that'd be a great help. In terms of running order today, you'll be hearing from me first, before I invite our other two panellists, Louise Stewart, Chief Executive for Alexandra Park and Palace, and Ruth Ann Baxter, Museum Services Manager at the University of Edinburgh, to talk through their case studies referred to by the Minister. I'll pick up the baton again to talk through the going viral case study before chairing the question and answer session. So next slide, please. My role today is to chair the launch event on behalf of the Heritage Alliance. I've been assisting the staff in developing this report on and off for over 2 years, and have a background and academic interest in developing health and wellbeing programmes from my long involvement in Operation Nightingale, former employment at Help for Heroes, which included leading 2 heritage-themed projects working with the charity's beneficiaries, and now in deepening the public benefit offer at Wessex Archaeology. I'm also going to say some words about the work that the Heritage Alliance does on behalf of the sector, briefly explain the genesis of the report released today, and provide a short overview of its contents and recommendations. In between Louise's and Ruth Ann's talks, I'll introduce a couple of videos showcasing other case studies in the report. As I mentioned, the last part of the launch event is a question and answer session, and the backstage team will be monitoring the questions that you can submit via the comments channel, as well as any Twitter feed questions that come in during the event. Next slide, please. For those of you who may not be familiar with the work Heritage Alliance do, it was established in 2002 as a membership organisation to represent the breadth of heritage interests in the UK and promote the central role of the independent movement in the heritage sector. A key output is advocacy on behalf of the members and on broader societal issues such as the importance of heritage to national prosperity and well-being. Member expertise is garnered through a number of advocacy groups, which are used to influence legislation and policy to opinion formers and decision makers in England. Some of this important work is coalesced into reports such as last year's Inspiring Creativity report, which explored the connectivity between the heritage sector and creative industries. It also supports capacity building within the sector, as exemplified by the current digital skills training programme funded by the National Heritage Lottery Fund in response to the impact of COVID-19. Next slide, please. So the report released today, entitled Heritage Health and Wellbeing, owes its origins to a Heritage Alliance debate held in London in late 2017. The provocation was, is heritage good for your health? And featured notable speakers from academia and the heritage sector, including Professor Helen Chatterjee from University College London and a pioneer practitioner, Richard Osgood of the Defence Infrastructure Organisation, featuring the work with injured service personnel and veterans on Operation Nightingale archaeology projects. The debate concluded that the heritage sector had made a positive contribution to societal well-being, but it was underrepresented and publicised compared with, say, the arts and culture sector, and the sector could contribute much more. The release last week of the Evidence Summary for Policy, the role of arts in improving health and wellbeing, prepared by University College London for DCMS, underlines the greater visibility of the arts sector in this regard compared to the heritage sector. So the Chief Executive, Lizzie Clitheroe-West, thought there was more to do and say on the role of heritage in promoting health and wellbeing, leading to a decision to develop this report. Along with the many member organisations contributing case studies that exemplify the diversity of ways in which heritage can be used to promote well-being, a number of key individuals have contributed to the writing of the report, showing dedication and talent in equal measure. And we're indebted to the following individuals shown on this next slide. I'd really like to highlight both Max Price and Sophie Keynes, who over the last 6 months really have been the engine room for getting this report prepared. And one name you don't see mentioned here, Iona Poppet, a new civil service fast streamer secondee, who's organised today's launch, and hopefully a very successful one too. In addition to those that contributed case studies, more of which in a bit, I'd also like to thank the contributors to the roundtable discussions that focused our attention on the challenges and recommendations sections of the report. So next slide, please. Turning now to the report itself, I'm going to provide an overview of the contents, challenges and recommendations. The report begins by examining what we know and does so with a short exploration of what is well-being, looking at the World Health Organization, New Economics Foundation and the What Works Centre for Wellbeing definitions, within the policy context and why wellbeing is important to society. And this acknowledges the additional impacts of the COVID-19 pandemic on physical and mental ill health. Next slide, please. So how can heritage support wellbeing? Well, this section summarises the published literature and research on the heritage contribution to wellbeing and include DCMS's 2016 Culture White Paper, the 2017 Creative Health Report of the All-Party Parliamentary Group on Arts, Health and Wellbeing. Now that's a mouthful. Historic England's 2019 Heritage and Society and Heritage Counts reports, and the National Trust 2017 Places That Make Us report. The report also covers some social return on investment data and some published academic research featuring UCL's study entitled Museums on Prescription, as well as Operation Nightingale's contribution to improving the mental health of veterans, which are now the subject of 2 peer-reviewed articles. The headline is that the power of heritage lies in its ability to combine diverse and innovative contributions to the 5 ways to wellbeing, all in one place. Next slide, please. The findings in this report shows that the Alliance membership is already doing much to support health and wellbeing in society, whether by design, such as the Human Henge project supporting people with mental health conditions, or as a consequence of its routine activities, or because of the heritage setting, an example being many historic homes that host park-run events. Heritage is unique in being able to provide a sense of community cohesion, opportunities for reflection, and scope to understand place, as exemplified in the Layers of History case study from Heritage Lincolnshire. We found that the wellbeing benefits of heritage are amplified if participants are allowed the autonomy to guide their own learning, which was the case for the Sporting Memories charity at the Church Conservation Trust's Key Place. The Inspiring Futures project has also shown that participating in heritage activity can help individuals develop new skills that stay with them for the long term, and this is especially the case for those at risk of exclusion from mainstream society. A focus on wellbeing can improve the sustainability of heritage organisations, for instance in the conservation of the Holy Trinity Church in Sunderland. And we believe that wellbeing should be central to strategy as we rebuild the sector after COVID-19. Next slide, please. The slide lists the case studies in the report. Now, there are over 30 case studies from more than 20 contributors in the report that represent the breadth and scope of the contribution of the heritage sector, either alone or in partnership, in promoting health and wellbeing. We asked each contributor to assess which of the New Economics Foundation 5 Ways to Wellbeing apply to their projects, and this is shown graphically in the top right of each case study. Now, we'll be summarising a few of these case studies in a short while via a couple of videos and the aforementioned speakers. The Places of Joy project, mentioned by the Minister, that one highlighted in yellow, is an ongoing study conducted by researchers at the universities at Southampton, Surrey and Cambridge, supported by Historic England and Heritage Alliance, is researching the nature of public engagement with heritage after the easing of COVID-19 lockdown measures and any changes in value placed upon that access. Next slide, please. So we've identified 4 key challenges. And the first, and that the DCMS Taking Part survey serves as a guide to how much the sector has to do in addressing health, social and economic inequalities. Our problem areas are in attracting and enabling young people aged between 16 and 24, individuals of Asian or Black ethnic origin, those in poorer financial circumstances, and those people living with long-term disability or illness. Fostering a connection with heritage from a young age is seen as especially important in this regard. Facilitating access to heritage venues is important, as is overcoming perception barriers, such as views that heritage sites solely embody historical power structures. Demonstrating the efficacy of health and wellbeing initiatives is seen as a key challenge too. The aforementioned DCMS policy evidence report for the arts sector shares this view. Gold standard randomised controlled trials and longitudinal evaluation are skilled and costly undertakings for heritage organisations. Moreover, the sheer range of project approaches that the sector can adopt, as demonstrated in the case studies, makes it difficult to adopt a one-size-fits-all approach to valuation. Partnerships with higher education establishments is seen as valuable in accessing expertise and resources to evidence impact. Capacity building within the heritage sector is a challenge. Sustainability of wellbeing programs, both in terms of structural and financial support, is key. Bridging the divide between the heritage and health sectors in terms of respective language and operating networks is necessary, although social prescribing offers a potential route for collaboration and mutual understanding. Heritage organisations also need to embed the concept and benefits of wellbeing as a key component within their cultures. COVID-19 has profoundly impacted the sector and society. In relation to wellbeing, social distancing, especially for older and vulnerable groups, has exacerbated what were already significant societal challenges around loneliness and isolation. Engagement with heritage is a great way to promote social connections, and the sector has much to offer in this space. Next slide, please. Our recommendations are structured in 3 parts: those applicable to the heritage sector, those for the health and care sector, and finally for the UK government. Our recommendations were tested and refined through 2 roundtable events with representation from within the sector and further afield. Next slide, please. Turning first to the heritage sector, we agreed 9 recommendations. We felt that embedding wellbeing within organisational strategies could assist with the resilience and help the sector be relevant and attuned to societal need. Time to embed wellbeing aims throughout an organisation would take commitment and time. Building in evaluation from the start is important, and start with the desired outcomes and then design or make use of an existing evaluation tool. This approach helps when engaging commissioners or funding bodies. Partnerships are powerful and can improve impact. Do consider partnerships with bodies outside the sector that may have expertise or access to participants that you need to be successful. Similarly, work with the local community. They have the networks and access to those individuals and groups that will benefit from a heritage-based project. And do engage your target audience from the outset. Empower them to co-design the project to deliver the activity and outcomes that will benefit them. And this is becoming an essential consideration for funding bodies. Accessibility is crucial, and we should be aiming to tackle inequity and social injustice. And this requires us to think long and hard about how we prioritise groups that may not be heritage's natural audience. Some of our case studies do point the way for those looking for some inspiration to do things differently. Sustainability is an important consideration in your project design, and your initiative should have a positive effect that endures beyond the activity if it's to achieve lasting health and wellbeing benefits for participants. Quite simply, we need to get better at showcasing our wellbeing work to demonstrate the instrumental impact the sector can make on society, and market this into the health sector, academia, and potential cross-sector partners. So the sector comes in all shapes and sizes. It is incumbent on us to share existing expertise through continuing professional development and help each other overcome perceived barriers to entry in delivering wellbeing programs. Next slide, please. In terms of the health and care sector, our recommendations target social prescribing services and commissioners. And for the social prescribers, we ask that you recognise that heritage can contribute to wellbeing as exampled throughout this report. And please also work with the sector to build sustainable partnerships at the local level of the primary care networks. For the commissioners, integrate heritage approaches into strategy, setting out an ambition to enhance the role of the historic environment as a key determinant in population health and wellbeing, linking it to personalised care strategy and commissioning intentions. And incorporate heritage approaches into training for healthcare professionals, alongside the current priority in the culture and health field, noting the manifold engagement opportunities that are a unique aspect of the heritage offer. And help heritage organisations collect the evaluation data you need to make the case for heritage. Will help the sector appropriately design methodologies. Next slide, please. For the UK government, we make these recommendations. Prioritise wellbeing as a policy outcome, as other governments have done. Wellbeing focused policy promotes commitment, accountability and a consistency across government and exemplifies how wellbeing can be incorporated into programme formulation and evaluation. Promote the power of heritage in policy making, recognising the sector as a significant role to play in promoting health and wellbeing in society. Government should work with the sector to develop a joint strategy to promote heritage, culture and the arts as significant non-clinical contributors to the health and wellbeing of the nation. Do ensure the right tools are in place for effective delivery, and while social prescriptions are a good way to engage hard-to-reach audiences with heritage, the proper funding must be in place for this work at scale sustainably. The government cannot simply pass on the cost of health provision to already struggling heritage organisations. In terms of wider policy considerations, we are urging greater consideration to be given to the intangible community and wellbeing benefits of heritage in the planning system. It's much more than simply a consideration of preserving the past. And finally, heritage should be central to our post-COVID renewal. The sector is ready and willing to play its part for the nation's recovery and can do so in a myriad of ways. This heritage value is not just old stuff, as has been demonstrated in this report, but does require sustained investment in the sector to continue this innovative programme delivery and support into the future. Thank you for your attention so far. I'd now like to share a short video on the Burgh Castle Almanac case study featuring an archaeology, creativity and wellbeing programme run at the Burgh Castle Roman Fort Time and Tide Museum in Great Yarmouth. Katie, if you could hit the play button, thank you.
Burgh Castle Almanac is an archaeology, creativity and wellbeing programme based at Burgh Castle's Roman Fort and the Time and Tide Museum in Great Yarmouth. Walking around the fort's ruins, the group usually takes the same route, taking fixed point photographs. These document the changing landscape and the impact the seasons have on the surrounding countryside.
The group understands something that society doesn't understand, and that is that every single person in this country on earth needs help with their mental health.
This one group has given me, I would say, confidence in other groups and given more things a go with the community.
These are people now who I will consider friends for life now. It's a fantastic experience, great, absolutely amazing.
So this clip is a preview of Burgh Almanac Castle's film, The Return of Happy, a restoration trust project that's funded by the National Lottery Community Fund. Tomorrow sees the premiere of the film in Lowestoft to further encourage interest in Norfolk's heritage and promote positive mental health. It's my pleasure to invite Louise Stewart now to discuss the Alexandra Palace case studies, Wild in the Park and Rhythm Stick. I'm looking forward to her talk about these projects serving young people and adults in the disabled community. For attendees, a reminder, please do tweet using the hashtag #HeritageHealthWellbeing. Over to you, Louise.
Here's hoping that the technology works. Hello, everybody. So, Alexandra Park and Palace, for those of you that don't know, is located between Muswell Hill and Wood Green in North London, and it's around 7.5 acres of Grade 2 historic building, surrounded by 196 acres of historic informal parkland. The park dates from 1863 and the palace 10 years later, 1873. The Victorian entrepreneurs who created it were inspired by the Great Exhibition and international exhibitions, and unfortunately, after fires and finances got the better of them, it was placed in trust by an Act of Parliament in 1901. And as a charity, we very much in the past focused on the first part of our charitable mission, which is to repair, restore and maintain. But over the last few years, we've really looked at the second part of that, the recreation, education, or in Victorian terms, they didn't mean formal education, they kind of meant betterment of society and enjoyment of the public, and really turned our purpose as an organisation on its head into enriching lives through great experiences forever. And that's built into our vision, whereby people feature as part of our vision, not just the historic assets that had been previously. What we're known for is brilliant music gigs, the Darts in December, amazing panoramic views over London. If you haven't been, they're the best. And as well as our theatre and exhibition and event halls, we also have an ice rink in the middle of the palace that a lot of people don't know about. And we're also known in heritage terms as the birthplace of the BBC television service. We receive around 4 million visits a year. And because of our very broad programme of entertainment and the fact that we're located in a very diverse city and borough, our audience is already pretty diverse, but we're conscious that we cannot be complacent. And our creative learning programme really is our engagement approach to focus our activity on making our site and activities more inclusive and beneficial for all, but actually trying to reduce the barriers to participation. And we were helped massively in this by a very large National Lottery Heritage Fund grant, which gave us the funding to restore our Victorian theatre and gave us some amazing new spaces to undertake our activity in a building that had previously been 40% derelict. We also have a dedicated inserted creativity pavilion learning space as well. And our creative learning programme covers all ages, supporting those suffering from loneliness and isolation, people living with Alzheimer's and dementia and their carers, as well as the 2 programmes focused on children and young adults that I'm going to speak about and that feature in the excellent Heritage Alliance report being launched today. On the right-hand side, we have Wild in the Park, which it grew from our work with young people in the BAME community and trying to amplify young voices on environmental concerns. And on the left-hand side, Rhythm Sticks, which was about working with disabled people, not in employment, education or training. So, Wild in the Park. This programme is very much about children and young people exploring their creativity in the outdoor learning environment and learning and exploring their environmental consciousness. It grew out of a smaller pilot programme which aimed to engage young people with emotional and behavioural difficulties and their ongoing therapeutic support in our engagement programmes. And it's designed and regularly reviewed through extensive consultation with local young people, our local pupil referral unit, Forest and Family, a bespoke deliverer, and local stakeholders, which has meant that the programme is now very much broadened out into families and features in our summer programme. The participants collaborate with a range of specialists from different fields, but those activities can happen outside of the formal sessions because the activities are available as free downloadable content. So school groups or family groups can undertake little excerpts of those activities when they're visiting the park. Those activities could be conservation, could be monitoring bird migration, could be seed bombing, or they could be on the formal side designing public art trails and creating sensory trails for people who live with mental health issues and their carers. There have been particular challenges with this programme. Evaluating the impact of well-being over a short time frame is particularly challenging, and the attendance and retention of many of the young people with social, emotional and behavioural issues, they do experience difficulties in regularly committing to sessions. That said, our impact has been felt. The observations and knowledge of specialist tutors and support workers are obviously invaluable to us, and they've absolutely seen a significant shift in pupil behaviour. Feedback from participants in the broader programme and activities, I think it's really telling, the middle one here, that I saw my dad relax for the first time in ages. That was an observation from a child under 7, and I think it's really powerful. One of the things that was built into the programme from the beginning was the importance of a lasting legacy, and that's where the trails really feature. That a lot of our programmes try to design something where the children and groups are leaving a footprint on the park, because it is absolutely seen as an essential for children with those emotional needs. But I think it's important for anybody participating in activity in this kind of setting. I think everybody values that legacy. Rhythm Sticks is a very, very different programme, and one that the team feel very emotional about themselves. This is a club night in our restored theatre, and it's run by and for people with disabilities. And it creates a regular social space for people in a very different setting. It's very inspiring, very unique setting. And it's aimed to help combat loneliness and isolation for adults in the disabled community who are leaving those support networks of education and may not be in work or in training. And it's a particular low part where people can feel very isolated. It's also aimed at not just increasing their independence, but also supporting development of work-based skills. There's a 10-week training programme before each event, focused on event management, where they undergo formal training, work shadowing, placements, talks and visits, and they work closely with our own in-house world-class events team at Alexandra Palace. The programme is overseen by ambassadors and specialists from the local disabled community who design and train the programme to make sure it absolutely is aimed at the right level and it contains the right aspects. They also act as advocates for the event, promoting within the disabled community for attendees at the events. The impact on this one is quite interesting. On the right-hand side is the impact on the participants. Dancing all night with my walking stick made me insanely happy. Tick, job done on my charitable purposes. But the others are absolutely what we had hoped and believed we would achieve. Helping me learn new skills, meeting other people, making new friends, and also from carers involved in the programme, what stuck out for them is when you make a space inclusive for the disabled community, it's a positive and rewarding experience for everyone. What I don't think we had expected to happen was the impact on our own organisation. The accessibility in a heritage setting, as I think we would all recognise, can be really challenging. And our organisation, like most, is absolutely strapped for resources. And accessibility is something that we all would, I think, like to do, but it's never top of the priorities. What this programme did was absolutely progressed our internal accessibility agenda, raising awareness of what we can do across the organisation. And one of the things that I genuinely thought we wouldn't achieve was on our live music agenda. There is a charity that focuses on accessibility in the live music scene called Attitude is Everything. And we're now making an application to meet their standard, which we believe we do for accessibility. It's also developed the skills of our own staff and volunteers in welcoming the needs of a broader demographic much more effectively and in a much more understanding way. And on a real bonus, Alexandra Palace has secured funding on the back of this programme for portable winches and changing benches so that we can take Rhythm Sticks on tour to other venues that have, and other programmes, on tour to venues with challenging access needs, which is a great addition to our assets. The biggest challenge that we have with Rhythm Sticks is the funding. The project has been an extremely positive experience for participants and for the team. The relations that have been built are really strong, and the skills developed do need longer term support. And the project is early stage. It's only funded until November this year. And although there was some interest from trusts and foundations pre-COVID, time will tell whether we're able to secure more funding or whether there's going to be hiatus in the project, but it's definitely something that we would like to continue to operate. And on that note, I will hand back to Giles and happy to take any questions in the Q&A session. Thank you very much.
Louise, on behalf of us all, thank you for that talk. And I find that most informative, moving and inspiring in equal measure. And for me, it helps bring to life what is possible and that positive impact that you stress for the staff. Could I just remind attendees that if you want to add any questions, you have the Q&A chat, and I see them building up already. What I'd like to now do is show you a video on the Community Access Scheme from Historic Royal Palaces, which offers free entry and practical advice for exploring the palace to adult community groups and education providers based locally to Kensington Palace. And Katie, if you could hit the play button again, much appreciated.
Knowledge is power for me. Every time I come here, I see something different. I learn something new. I feel like I'm privileged to be here.
It's important that local community take part in what goes on in the palace, because it's kind of help them to understand it's an integral part of their life, and that we are not a separate body, but we are all one community.
The Community Access Scheme is a program for people who live, work or study local to all of our palaces that enables them to come in for free or for discounted entry, explore and uncover stories and make sense of them in a relevant and meaningful way. Every time I'm with groups, I see the stories in a fresh way. They help me just, open my eyes to the world. They walk into the room and they say, whoa, never knew this existed. And these are places that right on the doorstep, and they walk past hundreds of times and just never felt that they were for them.
The palace is very important to the community because of the facilities here. It's a beautiful setting, we have the park, fresh air, beautiful garden. It's fantastic, bringing us all together in a forum like this. One wouldn't otherwise meet various people that have been here.
The thing about this community access group is I think it's a great scheme, because first they introduce people who have never been to museums or to any place like this to come to this place and to be close to their heritage first. They want to come over and over again, because every time they come, it feels like their first time.
It's something like bringing history to life. So this is why we enjoy being here. I feel this belongs to me. It belongs to us.
This is a great case study about opening up access to heritage for local communities that might otherwise not engage with a historic site. And I really love the way the clip captures the strong themes of the keep learning, take notice and connect 5 ways to wellbeing within a heritage setting in the participants' own words. And perhaps the most powerful takeaway point is about inclusive community building through facilitated empowerment. Next slide, please. I'm delighted to introduce Rithan Baxter now, and she's going to talk to us about the Edinburgh Prescribed Culture Programme case study and present some wider reflections on the intersection of heritage and wellbeing. And Rithan, the stage is now yours.
Thank you very much, Giles. Good morning, everybody. I think it's rather apt that I'm actually coming to you from a converted cottage hospital. My flat is in a nice heritage setting, and we're here to discuss health and well-being. So could I just get the first slide up, please, Katie? Thank you. The Prescribed Culture initiative that is happening at the University of Edinburgh, its starting point was in 2017-18. So essentially what happened was I was informed that there had been a 22% increase on the demand for the university's counselling services in that previous academic year. I need to explain that. That's not because necessarily going to university suddenly increases your chances of a mental health condition developing. It was a joint sort of situation where the universities have done a fantastic job in recent years of widening participation. So they are now seeing more students coming to campus who may have pre-existing mental health conditions. And also it's a great result from the campaigns and initiatives that have tried to reduce the stigma about talking about mental health conditions. So that is where those are definitely contributing factors to that rise. It was really important to me that the student population is a very transient population. Certainly at the University of Edinburgh and most universities, it's an international population. So you have to deal with people coming from different cultures. And one of the really interesting things about running prescribed culture at the university was you have a lot of students there who are coming from a culture where it's not actually acceptable to be open about having a mental health problem. And in the group who were the steering group, I was informed that it would be unlikely that we would see very many students from Asia taking part in the programme, simply because it related to mental health. However, this is a great note, if you like, on language. And we were talking earlier about accessibility, and it might sound strange, but your use of language is also part of that accessibility. And I don't mean in the language that's spoken or written. I mean the fact that apparently we did have about 8 of the participants in the prescribed culture pilot were from Asia. And one of the reasons given to me for that was because the name prescribed culture did not really denote anything to do with mental health. So they were able to, phone back to their parents and family in China, for example, and they would have been more delighted because it was a way of, them understanding more about Western culture. So again, just when you're choosing the title for any program you might set up, you might want to consider that use of language. So in September 2018, I set up a steering group, and I know I am very wary that I am extremely privileged to be working in a university setting, because it really is almost like a little country all of its own. It has its own GP services, it's got its own researchers, etc. And I have to admit, I made the most of that. So I was really lucky to bring on board a steering group that consisted of Andy Shanks, who is our Director of Student Wellbeing at the University of Edinburgh. I had representation around the table from the GPs, the counselling services and the chaplaincy. Also, very importantly, representation from the USA, who are the Students' Association, and also Dr. John Gillies, who is actually a senior advisor to the Global Health Academy, and also a lead on the initiative about compassionate health. And Dr. John Ennis, who himself was a student at Edinburgh University. He studied medicine, but he has moved away now from medicine into the world of design and environment. And he's doing a lot of great work there and encouraging students to get involved in that as well. And also around the table, we had a couple of the city cultural partners. Now, I do want to say a huge thank you because we were really, really fortunate in Edinburgh. The heritage and cultural sector up there were more than willing to get involved in this. And we had around that table people from the Scottish Chamber Orchestra and the Scottish Poetry Library for this group. The other thing that's not on that list that is extremely important is the fact that we did have a consultation group of students. Now, it was quite tricky because this is very new for the museum service at the university, and you couldn't exactly put out a tweet saying, dear students, anyone with a mental health problem, would you like to come and join our consultation group? So what we did was, at the university, there are plenty of societies, and one of the societies is called No More Blue Mondays. So they were students who had already self-identified and were very happy to be open about the fact that they were struggling with their mental well-being. So they were a group that we consulted with before we took off planning the prescribed culture pilot. Oh. Okay, so it was very important to me that we were going into an area of work that is not our usual area of work. I think it is extremely important to have at least awareness and understanding before you would go into working with any sort of side of health, but particularly with mental health. So these at the top are a list of some of the training sessions that I did before we got into planning. And you'll see that most of them, I have to highlight that most of these are available, most of them are free. I would check out futurelearn.com, it's a fantastic resource. But also I did a lot of reading. As you can see, I've got a little list there. That's about a quarter of the books that I have read over the past 2 years. If you are wanting a really quick glance in, I would go with the top one, Lost Connections, and the very bottom one, A Biography to Loneliness, and that's written by Faye Alberti from the University of York, and there's great stuff in there, very much connected to material items as well. However, this is what you can see on the screen are the 4 programs that are now or will be on offer to the students at the University of Edinburgh in this 2021 academic year. I'm just going to take you through them quite slowly because 2 of these were involved in the pilot which we ran before Christmas and 2 are brand new. So I'm going to go with the pilot ones first. Take 30 was basically a booklet that was brought together, and the purpose of it was twofold. One, it was to give students who did not want to join a group, primarily thought about students who were maybe dealing with anxiety, panic attacks, and the idea of joining a group of strangers in a very structured way may have just like added to their anxiety. So we very consciously decided that this would be an old-fashioned 3D in your hand booklet rather than anything online. The main reason for that was again using research, and there's a fantastic piece of work going on with Elaine Fox at the University of Oxford, and she's been working with students who have mental health difficulties and discussing digital mental health apps and so on. And whilst they completely agree that those have a place and they can be a level of support, they did sort of say that, you know, they spend a lot of time on screen and they'd really do something that wasn't on screen if they possibly could. So again, this was very much a city coming together. So a beautiful coming together with, for example, the National Galleries of Scotland, the National Museums, the Botanic Gardens, St Giles Cathedral, all sorts of heritage venues and sites. We took in the Meadows, so we worked with Archaeology Scotland, and on the Meadows, which is right next to the university's main library, there are 3 archaeological sites. So this was like a little booklet, and the main point was to try and get the students off campus, out into the broader city, discovering new things and taking some time to do little prompt and response exercises. The slightly more in-depth one is Programme 6, and I'm going to speak about a little bit more about it in a minute. And Programme 6 was again working closely with other city heritage partners, and it ran for 6 weeks, 90-minute sessions, made up of basically half an hour of being introduced to a collection item or an archive, about 10 or 15 minutes of tea, coffee and chat and socialising, which is also very important. And then the last section was always just something, what I sort of tend to call a little bit amateur hour crafts. And again, I'll speak about that in a minute, but those 2 were the pilot programs. And in essence, it was all evaluated by an independent Claire Gilchrist researcher who did a fantastic job. And she basically came back, having spoken to the various stakeholders, came back and said, this has been very beneficial and all the stakeholders would like to see it go ahead in the future. And we were in the process of working on that when COVID struck. So in response to COVID, we now have 2 new programs coming on board. So Take 30 Together Virtual, that is another one I'm going to speak about in a little bit more depth in a wee minute. That is available right now, twice weekly. It's been up and going since May. And the other one is Going Local, which we're also running with the tagline of an Edinburgh historic welcome. And that again is using our city friends to really get the students out and about across the city, meeting more local people, meeting more community-based initiatives, as well as what's available on campus. So we're going to run that as part of the university's Mental Health Weeks, which is running in November. And I can tell anybody a bit more about that. It's to support the students feel a sense of belonging in their new home. So if I go to the next slide. Thank you. So Programme 6 was the more intensive one. Now, this one is the one that needed a lot of prepping, because it is a lot more resource intense than the other options. I should have said that the only funding that was needed for the pilot of prescribed culture was I needed funding for the actual evaluation, which was incredibly important, and the steering group were absolutely in agreement that our starting point was to sort of find out what worked and what didn't work. So we were very grateful to Museums Galleries Scotland for their support in paying an independent evaluation consultant to do that piece of work. And the other piece of funding required was I was quite adamant that all of the deliverers for Programme 6 undertook the Scottish Mental Health First Aid course. And that comes in at about £1,800, but you can train up to 16 people. So I just wanted to make sure that, one, all of the deliverers were comfortable and had training, because I think that is hugely important. I'll come back to that in a wee minute. But Programme 6, as I said earlier, is essentially a 90-minute programme that went weekly for 6 weeks. This, I've done a little summary here of some of the feedback. As someone who has ongoing mental health issues, prescribed culture helped me greatly. Another member said, it gave me calming activities, a much more productive and helpful way to distract myself and relax than I had before. It is a useful addition to other forms of support. That is really important, because in no way is prescribed culture going to cure or really heal any student who is suffering from any significant level of mental health. I tend to suggest that it is more of an ibuprofen than an antibiotic. It is going to provide a little relief. It's not going to be a cure. So what we did, if I can give you a little example of what one of the sessions might have looked like. So, for example, I ran the Programme 6 in partnership with the National Library of Scotland with wonderful Bev Casebo, and each week we looked at a different, it was mostly people from their archives. So one week we looked at the wonderful Isabella Bird. We discussed Isabella, we discussed what she did with her life, inspirational female. She had quite a few funny stories. She apparently really confused the doctors in Edinburgh at the time, because when she was in Edinburgh, she was very unwell, very what we might call depressed. But as soon as apparently she got on the board to go on a boat to go somewhere else in the world, she was miraculously cured. So I think she just enjoyed being out and about and stimulated. But what we looked at from an object point of view was her Korean passport, which, if anyone knows what that might have looked like back in the 19th century, was a huge, beautiful piece of artwork, if you ask me. And we would have discussed Isabella, had tea and coffee, and then everybody made their own Korean passport. So that was lovely. If I can go on to the next slide, please. Okay, so this is the option that's available just now. What is brilliant about this is the fact that because it is digital, we can go anywhere in the world, and we have gone to lots of places across the globe with the members to look at different bits of heritage. We've been to the Shangri-La Museum in Hawaii, the Living Museums in Sydney. We're going off to the decorated farmhouses in Sweden, and it's really a wonderful way to promote world heritage to the student members who are taking part in this Take 30 Together virtual programme. What you need essentially is to be registered with Prescribed Culture, and then you get an invitation every Wednesday and Friday to wherever it is we're visiting on that occasion. The visits are led by a guest guide. The guest guide is usually somebody who's, for example, a curator, an archivist, or the visitor experience manager, or indeed a volunteer. We've done things like also looked at, we had a fantastic session with Alan Reich, who is from the Scottish Beekeeping Society, and we had a Heritage of the Honeybee Day, which was really a successful event. Everybody was very intrigued by that. what has happened with this is it was created specifically for the student population. However, we then opened it up to staff, because when COVID made sure that everyone was working from home, there were also a lot of staff, like there are in plenty of businesses and organizations, not sort of maybe liking the being at home and feeling a little bit more isolated than normal, etc. So in addition to that, it has now been made available on the National Wellbeing Hub for Scotland. So if you go onto that website, you can get a link in there, and they have placed it under the section called Getting Connected, which apparently is actually their most clicked on page. So obviously a lot of people out there just now needing a bit of support to stay connected socially. So Take 30 Together Virtual is very much what I call an e-social prescribing program. And like I say, pretty much at this point open to anyone. So if you are looking for a little bit of escape on a Wednesday or Friday lunchtime, do please just sign up to Prescribed Culture, and we will make sure that you get an invite to that. If I go on to the last slide. Okay, so what I was just going to say in summary, I'll go back to training. What I think is really important just now, and what I've observed and in conversation with other colleagues at heritage organisations, certainly across Scotland, is that, you know, there are a lot of organisations now looking very much to their education or engagement officers and teams to help with developing well-being and health programs. Now that is fantastic, but I would say, especially if there are senior managers on the call, that you would consider the fact that those people will need some training and some support. You know, I like to say that, you know, if somebody rolled up to you with a car and said, "Hi, I'm a curator, I built this car, I've not had any training, I've not spoken or consulted with any car designers or mechanics, but, you know, just jump in and give it a go," I think we'd be very reluctant to get in that car. So it's the same thing. We have to, when we are developing something that we are branding as a well-being or a health support, we absolutely need to be speaking to the right people and very much engaging with our local GPs or care sector representatives and the wonderful social prescribing link workers that are available in most parts of the UK at this point. Giles had mentioned earlier also about the sort of lack of research and lack of longitudinal studies, etc., that are currently out there promoting heritage's role in health and well-being. You know, somebody had said to me a wee while ago about, you know, the arts, are the arts not the same as heritage? Well, in essence, no, they're not. And it's not about competition, it's about creating additional options, giving the person who needs support with their health other choices. You know, just as in the biomedical sense, you may be, you know, given a drug that doesn't suit you, then it's the same thing with psychosocial options. If we keep getting heritage on that radar to be up there alongside sports and nature and the arts, then we are simply providing somebody who is seeking health and well-being support with greater options. But just to finish off, at the university, again, I'm very fortunate in that I have been working quite closely recently with colleagues from the School of Clinical Sciences and Psychology. We are about to submit a funding application to the Medical Research Council, very specifically on the transition and adaptation of adolescent minds. So what we're going to try and do, if we are successful with the funding application, is to bring about an intervention option which gives young people a sort of a choice between sports and heritage. So we're going to be using Prescribed Culture and a wonderful sports initiative called the School of Hard Knocks, which is a rugby-based intervention option. That will hopefully, if it is funded, go on for about 3 years. The other thing that has come about with Prescribed Culture is also connected to the School of Social Work at Dundee University. Back in June, we have submitted an application to the Nuffield Foundation to see if we can get some funding to see how we can create integration policies for the arts, culture and social work. And finally, again in Edinburgh, we're just about to start a little piece of work on the dementia audiences, making sure that we develop programs that are as accessible as possible to the dementia community in Edinburgh and the Lothians, working very closely with Age Scotland and a lot of the other cultural partners in the city. So if anybody wants any more information on any of this, I'm sorry that was a bit of a fast bite-sized run through, please do contact me directly on either Twitter or give me an email.
Ruth Ann, thank you so much for that presentation, highlighting the benefits of creative activity inspired by heritage on mental wellbeing with the student community. I thought your points on the careful selection of language, naming a project, the staff training requirement, and managing expectations on its benefits, plus the fact that heritage can be seen as a complementary pathway, was really well made. I think it's also topical for those students that to a greater or lesser extent experiencing relative confinement, greater isolation and uncertainty in their studies given the COVID-19 situation. So thank you. What I'm going to do now is just finish the case studies, highlighting my own organisation's response to COVID-19. For us, all our face-to-face public engagement programmes and events as an educational charity ceased. In response, quite simply, we took to the digital space with varying degrees of sophistication to try and bridge the void with products that had at least one element of well-being in them. One offering was the 360-degree recordings of heritage landscapes uploaded to our YouTube channel under the title Moment of Calm. Another was entitled Drawing on Heritage, sharing on our social media channels where the studio staff digitally converted heritage sites and artefacts into line drawings that could then be downloaded and coloured in as a mindful activity. Another simple offering was creating online jigsaws of heritage sites for individuals to complete in their own time. At a higher level of endeavour, we adopted a webinar platform, no names mentioned, to replicate our public lectures programme and work with partners like Bristol Libraries to maintain our Keep Learning service to the public. The added bonus of going online was that we grew audience numbers, including international attendees. And recording the webinars enabled us to post them on YouTube to enable others to benefit from the content after the event. We also trialled a heritage-themed online intervention programme with a small group of individuals in the Salisbury area with mental health conditions, stuck at home and unable to access support services during lockdown. This evaluated programme of 5 facilitated sessions engaged participants with heritage material and created opportunities to perform creative tasks between sessions. As well as being a positive wellbeing experience for the participants, enabled us to understand how best to deliver online wellbeing activities and, importantly, to provide the necessary psychological safety for the group engaging in an unfamiliar medium. The feedback on access inclusion was important in designing our Historic England Emergency Fund Lost and Found project, which enables online participants to discover and learn about artefacts hidden in our archives and then select objects to be curated as 3-dimensional scans in exhibits in a virtual museum gallery that will be accessible to the public. Through Lee Chalmers, to date, the project has involved a range of participant groups that include individuals living independently with disability, some NHS staff, pupils at the Braidwood Trust School for the Deaf, and that often forgotten group, the carers. We have discovered that you can have a significant positive impact on wellbeing for a wide range of audiences through online heritage offerings, and we'll be sharing our insights at the conclusion of this project. So next slide, please. I'm now going to invite the other panellists and Lizzie Glithero-West to join me in a question and answer session. And while we ready ourselves, can I remind the Twitter adepts once more to tweet using the hashtag heritage and health and wellbeing. So if everyone could go on live for me. Ruth Ann, brilliant, thank you. Right, I see our first question, and we actually have a bit more time than we envisaged, which is great. The first question's from Sam Cooper, heritage practitioner, and I think I'd like to direct that to Louise, please. And the question is, with rhythm sticks, how did you know what the young disabled people wanted to do and would most benefit from?
We didn't. None of us, I'm not young anymore, and I'm definitely not disabled, and nor are a lot of my team. We didn't know that we were going to be delivering a club night. I think what we did was we recognised that a group of people were using the park, and we needed to make contact with them to see how we could get that engagement with more of the park, more of the building. So we made contact with local community groups, with the disabled community, and asked them what they wanted. And I think the reason that a club night came up was two things. One is because Alexandra Palace is so cool. You know, it is a great music venue, and it's something that the young disabled community probably feel that they couldn't really access. And they're at a stage of life when that's absolutely what they want to do. And so actually it was a dialogue of, this is what we've got, this is what we're trying to achieve, what are you trying to achieve, what do you need? And what came out of it was a club night and a training programme designed to meet the needs of that audience, both as a participant in an event, but also as a training programme for skills and event management. So it's quite a scary, we talk about co-creation and co-production, and it's quite a scary prospect, actually, because you don't know where you're going to end up. And the fear is that you might end up saying no, but quite often you don't end up saying no, you end up with something really brilliant.
Okay, Louise, thank you very much for that. Anyone else on the panel, anything else to add in some of the wider points there?
I would just throw in, Giles, that if anybody is interested, I'm sure, Louise, maybe you know about this, but there's an organisation called Gig Buddies, and essentially there's certainly one in the south of England and there's one in Scotland, and they very much work, they're more or less a buddying system. So they take an able-bodied person and pair them with somebody who has disabilities, including learning disabilities. But what they want to do is ensure that adults with learning difficulties have exactly the same social opportunities as other adults. And quite often they just recognise the fact that a lot of adults with learning disabilities were getting things like slightly patronising, things like a disco in the primary school that was over at 10 p.m. So if anybody else is wanting to link in, you might look up Gig Buddies, because they're a good way to connect in.
Okay, Ruthann, thank you. Our second question comes from Philip Long from Joined Up Heritage Sheffield. And he's asked, would it be helpful strategically for heritage to align more explicitly with culture, the arts, creative industries and tourism as sectors to strengthen the case for support and policy recognition and avoid competing for resources? And she won't thank me, but Lizzie, I think that's very much a question for you to field, please.
Yeah, thank you, Giles. It's a really good question. A couple of thoughts on this. I think when people talk about culture, sometimes they think about heritage as part of that, and often when it's thought about in government terms, just because of ministerial portfolios or the way that the arm's length bodies are arranged or funding is arranged, that sometimes heritage is seen as not part of culture. I think when I think about heritage, I think it's very much part of culture. It's very much interwoven with some of those other sectors that you've named there, Giles, and named in the question. And I think our report last year, which I'd commend to people to go and have a look at as well, was looking at how heritage is really the bedrock of other forms of creative endeavour, from the creative industries and the arts, all the way through to filmmaking and providing a muse and a backdrop of those other things. So I'd say that heritage is very much at the core and the heart of those other sectors, and we work very closely with them already. But what I'd say is, one of the reasons that we did want to produce this report is that I think the museums have done a lot in this space. There's been a lot that the arts have already spoken about, and we wanted to gather some case studies to really demonstrate that the heritage sector is already doing a lot of this and hasn't been talking about it explicitly, and also doing this with other parts of culture. Some of the destinations and the case studies within our report are very much tourism destinations as well as heritage destinations, for instance. So I think what this really does is it gives us a report, and it gives us a kind of stock of case studies and evidence to go and have better conversations with those other parts of our sector, to be coming to the table and saying, you know, we're integral to what you're doing, but we can also add to this, and also bring some recommendations that we think will help us with those kind of other abutting and crossing over sectors. So it's a good question. I think it's really important, and I'm hoping that this report's really the beginning of conversations with some of those other sectors, with linking up with them, and also helping us to be able to talk to policymakers about how integral heritage can be to getting us out of this really challenging period as a society. And we'd love to hear from people on this call, I'd say, as well, who are part of those other sectors, both health, but also the other ones mentioned, because I really do hope that this is more of a start of a 10 or the middle of a conversation, definitely not the end. And we'll look at what people around this table want to see next. And I think this is very much a kind of call to action, really, for us to be thinking about what do we as a sector need to be able to really showcase this stuff and take these discussions forward. So look forward to hearing everyone that we can't hear from necessarily, that's sort of sat behind the Q&A today.
Lizzie, thank you. Really good context there. This is all about partnerships and opportunities, isn't it, really, in terms of everyone having their role to play.
Definitely.
And I think Ruth Ann's point about different things for different people extends beyond just the heritage sector here. So great. I've got a question here. Please forgive my pronunciation. I've got it wrong, but it's from Irini Galou from Historic England. And she's asked, from the review of so many interesting cases, what would you suggest to the sector in terms of working with a certain age and social groups, vulnerable in brackets here, especially for places who want to start this, compared to ones who already do such work? And if I may ask Ruth Ann perhaps to make a start, and then possibly Louise to come in on this question as well. Thank you.
Sure. Really good question, Irini. I would suggest that, like anything, you know, whenever we look at, again, I use the example of education teams in heritage sectors, you know, a lot of them will focus on early years, primary, secondary. You have your adult education people. There is such a broad, I mean, a physical health difficulty can be very much connected to a mental health difficulty, but they're very, very different things. And I think it would be quite impossible for a heritage organisation that hasn't really worked in a health and well-being sort of pool, if you like, to just try and go in and solve all problems. I would strongly suggest that people look around your team, look at your communities and what is the greatest need in your community, but start by going, I would suggest, to the gatekeepers, to the stakeholders who work with that group, because what I have learned, well, certainly with social prescribing, is that one of the key things about the social prescribing link worker is that the patient has a huge level of trust in the relationship with their doctor. When the doctor then refers that person to the social prescribing link worker, they have to slowly start building that trust as well. So whilst your organisation may be, Louise referred earlier to what Alexandra Palace is known for, there are very few heritage organisations that are known for supporting health and well-being at the moment. So there's a great deal of trust to be built there, and the best place to go is to first of all speak to the people who look after that community. That's what I would suggest, and take it step at a time, not try and sort the world out.
Ruth Ann, great. Louise, you got any other comments that you could add to that?
I think some of the things that we take into consideration is trying not to repeat what others are doing, but really add value. What's missing? What can we add that is beneficial, rather than just taking from elsewhere and repeating or competing for resources or competing for the audience. So we do that, and we also make sure it's right for us. Why should we be delivering it? We always make sure that we talk to the experts. You know, We don't have the experience across everything we do to deal with the specialisms as well. And it's making sure that we do go to those gatekeepers, absolutely back up what Ruthann says. And a really important gatekeeper for us has been the local authority in terms of their public health agenda and their links to the social prescribing network, but also their culture teams. They often have lots of things and partners that want to do things. They're very frustrated through lack of resources. So they're a wealth of information and contact making for routes into the community and community groups. And then the other thing that I would absolutely have to advocate is making sure that your organisation is fit for purpose to deliver some of these activities, making sure your policies and your training on safeguarding and everything is in place, because you just, as a sector, we cannot afford to get that wrong. Other sectors are probably, because they've been working in these fields for longer, probably more advanced than some of us. So don't forget the basics and putting that framework in place.
Yeah, thank you both. I couldn't add anything to the answers you've given to that excellent question. Thank you. The next question I've got is from Alison Lightbound from Historic Royal Palaces. And I said, great to hear about these case studies from Alexandra Palace, but she's really interested in how participants are recruited, who the partners are, and how it's funded. And I think it's a no-brainer. Louise, response from you, please.
Well, very much what I've just said in terms of identifying where we want to go and go into those gatekeepers is how we find our partners. But sometimes it's been people on site that we've noticed are using our site. We have a lot of different ethnic communities that will use the park but don't necessarily participate in our activities, so inside the building, and we don't see them in our family activities in the summer. So the Kurdish community is particularly strong in Haringey, which is our local borough, and its links into those different communities. How different ethnicities decide to socialize and enjoy culture and heritage is very different, and it's trying to understand that. Yet we do see them benefiting, and it's from the park and the historic environment, so it's appreciated. It's how we can do more, so it's starting that dialogue. In terms of funding, this whole strand of work was massively spearheaded by the National Lottery Heritage Fund restoration of Alexandra Palace, and the need to engage our full community and all areas, all aspects of the public. And so that really spearheaded it. But since then, we've had funding from many other organisations, some from the work that we do on our client side. So some of our clients have charitable trusts and foundations, other charitable trusts and foundations, both local and national, that we've managed to secure. And it's often small amounts of money, but that can actually fund a programme for a year or two.
Okay, thank you very much. Next question is an interesting one, plays towards impact on staff, and it's Polly Groom has asked, Louise mentioned that staff have an emotional link to Rhythm Sticks project. So does the evaluation of this and other programmes look at the impact on staff? For example, personal organisational skills development and capacity building, but also impacts on staff wellbeing. I'll just make a start and just make the observation for those that have been participating on Lost and Found. It's had a really strong positive impact on wellbeing, giving meaning and purpose to heritage in working with some of these groups. But perhaps I'll just hand that one to Louise first, and then Ruthann, because Ruthann also talked about evaluation consultants.
I don't know that we've actually set out to measure it. It was an observation that myself and the creative learning team and others made. I think it's something that we will probably include in our staff surveys in future to find out if this activity is as important to them as we think. But it is a running issue that we have in our organisation, is things like Black Lives Matter, things like the sustainability agenda and inclusion are really important to our staff, and it's important that they see us doing this. And it's something that I think it's not a surprise, but it is a surprise that it's so strong. And the generations coming up behind us are so vocal about it, and their expectations are so high. So I think it's something that we should be very aware that is important to our staff and how they feel about our organisations and working for us.
Okay, thank you. We've got another question here linked to evaluations from Elisa McFarlane. And do any panelists have any tips on finding baseline data regarding participant wellbeing? Evaluation, of course, is key, but I'm interested in where baselines were taken from. Can anyone help me out on that one?
Hi, Elsa. So there's a small amount of research and baseline work out there with the student mental health general population, not linking it in any way to how interventions with culture can affect that. So we did initially a pre-project and a post-project survey with the students who participated in the prescribed culture pilot. And it was really interesting because, again, it's about making sure that your evaluation questions are tightly aligned to what you are definitely delivering. And one of the statements in the original evaluation draft was sort of basically scoring, do you feel more socially connected? Now, I was really aware that with the pilot project, we were essentially sending the student participants off to groups that did not previously exist. So I could not guarantee that there would be a huge social interconnection, but I could guarantee that they would be very much exposed to cultural items and objects. So we changed that to read as two separate statements. And one was, I felt like I connected socially, and the other one was, I felt more connected to the world around me. And interestingly, in the evaluation feedback, 100% said they felt connected to the world around them. And I think about 80% said they felt socially connected. So again, it's just about making sure that you are aligning up your evaluation questions with what you are actually delivering and not going, as Giles said, above and beyond.
Ruthann, thank you. Just two other things came to mind for me. The Office for National Statistics probably will include baseline data around different groups. And I also think that the Warwick-Edinburgh Mental Wellbeing Scale also has some baseline data against different participant groups if you were to elect that type of evaluation methodology. Okay, next question is from Eddie Tulezowick, if I'm pronounced that name correctly, and apologies if I haven't, has asked, is there a problem that often people think that heritage is about buildings or things, but arts are seen as about people? And do we need to tackle that issue? And I think, can I hand that one to you, Lizzie, just to make a start, please, and then invite...
I'll kick off, but I'm sure my fellow panelists will have real thoughts on this. I think that can be a danger. But I think work like this, the work about the creative industries last year, and just the amount of public engagement with debates about heritage, for good or ill right now, just really demonstrate that heritage is fundamentally about people. And that's why we're here. It's about people using the wonderful assets that we have, and we're preserving them for future generations. And I think there is a real danger traditionally that might be the case, but I think there's so much innovative and generous work gone on, particularly over this COVID period, bringing our heritage through digital means to wider audiences, and just the amount of feedback that we're hearing about heritage being these places of joy where people can come back and see their families, they can use these spaces, they can be inspired by them. We've got some way to go, I really do think, in that space, absolutely, and I think that's why the arts might be connected, as you say, much more with people, with activity. But I'd say that we're the backdrop and the enabler for a lot of that stuff. And for a long time, I've wanted to make sure that heritage is really not forgotten, because sometimes you can forget the backdrop, or you can forget the enabler or the arena of this activity. And without us, a lot of this other stuff couldn't happen.
Lizzie, thank you. Louise, Ruthann, any other points on that one?
I mean, we do have a really large heritage building, but the advantage we have is it's not a royal palace. It's not associated with just one family. Our building is basically the story of people at leisure since 1863, and so we can tell all sorts of stories and engage with people in all sorts of ways, whether that's through creative industries and our history on that and the people behind the scenes, whether it's our time as a refugee or internment camp during the wars. And we absolutely use people to engage people. And we also encourage people who are participating in our activities now to understand that they are creating heritage for the future. How they are spending their leisure time now is a story to tell in the future. Who knows how people will enjoy music or events and exhibitions after COVID, who knows? But this is creating heritage now, and heritage absolutely is about how people are spending their time and what they are doing. And I think that the next iteration for heritage is to always remember the people aspect. The buildings are amazing and important, but they were built and designed by people for people.
Very nice there. Yeah, just to really summarise here, I think this ties back to one of our recommendations here, that we need to talk about the work that we do, and we need to see heritage as an enabler, as Lizzie mentioned. And at the end of the day, this is about people, and every piece of heritage has got a story. That's what it's all about. So if we can bring those together, I think that might start bridging some of this perhaps perception gap. Next question is from Katie Mitchell from the University of Sunderland. And she's asked, regarding sustainability, how can organisations plan for sustainability when funding in arts, culture and heritage is so project-based? And I think I'll make a start on that one. That is very, very true. Lots of things are based in project terms. So we go out to a funding body, a trust maybe, for a period of time, or to some of the larger funding bodies. So for me, this is about the purpose of the project in terms of creating a long-term effect. So you've got to think beyond the project. You've got to think about those participants then being enabled to make use of a heritage setting or a heritage opportunity to do this for themselves. So we're promoting independence, but making access and use of heritage. The other area perhaps is in our relationship with the healthcare sector, and that if we can establish our credibility as a provider of health and wellbeing activities, then perhaps we can get onto a more sustainable basis that isn't just dependent on that short period grant that may come in from other sources. So there were my 2 points to that. Has anyone else from the panel got any comments that they could add to what I've said?
Yeah, just a couple of short ones, and I'm sure my colleagues do as well. I think one of the things that I've been pondering over this time is, I believe heritage is important in its own right. I would say that, but I think one of the sustainable futures for heritage is going to be us demonstrating that we are part of the solution for other public policy problems. We are heading into a really difficult time, a real funding challenge. There's so much generosity being shown by government right now to haul us through this period, but this will not go on forever. And I think one of the areas that government both needs to save in, but also invest in is health. And if we're able to demonstrate we're part of the solution to that, we're part of the solution to sustainable communities, to quality of place, to all of these discussions, I think that will help. It will help fund our own sustainability as well by demonstrating those things. And I don't think we could get away with not thinking in that way over the next few years. And not only that, but what is so wonderful about these case studies, that they're showing tangible impacts on real people. And this is our sector changing lives. So I think we can think about it both ways, both as a way to ensure that we can sustain ourselves through supporting solutions, but also that this is a real way that we can touch lives right at the edge. I think that this is where we can feel real joy in our jobs as well, if we're able to show that the sector can do this stuff.
Yeah, Lizzie, thanks. Louise, Ruthann, anything else to add?
I would probably add that one of my observations is that the work that we've done on the engagement of groups that would normally have barriers to accessing heritage and might not identify naturally with a massive Victorian building and a very Victorian parkland setting is actually, it's been really important to our stakeholders and the wider local community that we do this. It's almost as if the sustainability of it needs to come from our own organisation, which is cash strapped. So actually the funding from others allows us to build that momentum and get the project up and running. But we as an organisation need to get the funding into our core to make sure that we can support that long term. So it's the project-based funding has a role to play, but we need to be thinking long term how we do that. And the stakeholders and funders have definitely noticed a shift at Alexandra Palace, and therefore it has attracted more funding for the project-based things. And especially there are so many trusts and foundations out there that's a specialist that you can get small pilots underway to prove the case internally and externally, and then that wider community support. We've raised over £150,000 straight donations from the public due to COVID, and we barely did any fundraising from the public previously, other than for the theatre, which was a really long, hard slog. And that is because they've really valued what we have done and these activities that we switched online during COVID in order to still support our communities. And that it does start to open up a funding channel. It's just a slow process.
I would just sort of say on a non-financial sustainability point of view, some of the things that we're working on just now with the medical school at University of Edinburgh is bringing the social prescribing concept very closely into their undergrad. So this academic year coming in will be the first academic year where all the undergrad medical students will sort of hear about social prescribing, and obviously heritage being a key part of that. So I think, you know, also the sustainability is just keeping us on the radar of those who will be working in the health and care sector in the future.
Okay, thank you.
Charles, can I just add one other thought, just on the back of what Ruth Ann was saying as well? I think this all links into other important discussions that are happening right now about inclusion, about diversity, about the future of our audiences as well. And if we can be bringing in other people as a result of improving a whole range of different outcomes for them, that's incredibly positive, to the extent that our next report, or our next project that we're going to be looking at, is around inclusion and diversity, following on from a debate a couple of years ago. All these things are connected and sort of build on top of each other. I think this really helps us to be the most broad and welcoming sector that we can be, if we're thinking about positive wellbeing outcomes for all those who might visit our sites.
Okay, Lizzie, thank you.
Use our resources.
Thanks, Lizzie. I'm very conscious of time, so please forgive me if I do jump some of the questions, just to make sure we get the breadth of debate here today. The question here I've got is from Nicola Power, a museum and heritage consultant, and she's asked, what are the key places, forums, networks that cultural and heritage organisations can become part of, both at strategic and delivery level, in their community to mainstream these partnerships? If I could open that up to Ruth Ann and Louise in the first instance.
Sure. So I know I keep harping on about the social prescribing link workers, but that's a great place to start. Fortunately, in England, you guys are marvellously have your National Academy of Social Prescribing, so that's fantastic. We'd love to have one of those in Scotland. The other sort of networks that I know about, there's a lot of ones that are very specific about student mental health. So if that's of interest, and I mean, it obviously focuses on university students, but it can equally apply to sort of colleges, so further education as well. I can see if I can get some links to those into the chat line. One of them is March, which is sort of early researchers, and then the other one, another really good place is social prescribing, the Spring Social Prescribing. They also do a lot of work at home in Northern Ireland and in Scotland. So I think getting in front of those gatekeepers, whatever way you can, is really useful.
And I would just reiterate the local authority for us has been absolutely critical. They're so well connected at national and local level that as a first port of call to understand what networks might actually exist is a really good first step.
Yeah, no, thank you both. I'd agree both of those points. And there are a range of other sort of localised groups. I know London has got quite a combination of cultural links in around the health, which I'm sure we can share after this event, and it'll be the same up and down the country. Going to turn to this question now from Tanya Spilsbury, a Conservative Development Manager, and she's asked, how do we tie in physical health to promote mental health? For example, by supporting cycleway and sustainable access routes through heritage sites. This is something we're developing in the Derwent Valley Mills World Heritage Site. Lizzie, could I just ask you to start on that, and then anyone else come in for it?
Yeah, of course. I think one of the things that we really wanted to do in this report was showcase the full range of different types of intervention. So we've talked a bit about social prescribing, we've talked about wellbeing today, but there are some great physical case study examples as well in our report, ranging from, I know Emma's on the call today, from historic houses and yoga at Powderham, and some of the sorts of things that the National Trust and other big heritage sites are putting on their sites and on their grounds. A lot of them have a lot of natural space, and that's all really a brilliant resource to be enabling some of this activity as well. So do have a look at the report, because it has quite a lot on the kind of physical side in there as well. But I think this also does link in with other things that the Heritage Alliance are doing. And on the last question, I didn't jump in, but at the strategic level, we'd love you to be people on the call today to be joining the Alliance and helping us with the kind of the policy and the strategic discussions in this space, because other things we think about are good planning, good design, thinking about working with the departments for housing and for transport and other areas as well, to ensure that heritage is thought about as a solution for lots of different government targets and areas of policy thinking as well. So this all links in and is an amazing resource for us in the Alliance to use in advocacy as well, to demonstrate where some of this stuff really works and also what it needs to be able to flourish in the future.
Lizzie, thank you. Louise, anything? You're a site.
One of the things people say to me, being based in London, is how hard we are to reach. And I just say, honestly, there are so many regional heritage or visitor attractions that would kill for our location to be right within 5 miles spitting distance of one of the world's best and most successful tourism destinations. We've got a tube station within 15-minute walk, an overground train station within 10 minutes, and where you can get all the way from central London parks on greenways right to our door. Admittedly, you do have to climb quite a steep hill at the end. I don't think it's that steep. So I'm not necessarily best able to comment. One of the things that has been a challenge for us is, what do we mean by cycle routes? And the creation of tarmacked routes across our heritage setting that we would then be responsible for maintaining has meant that I've been very reluctant to allow Sustrans to put more routes through our parkland. So on some, as a keen cyclist myself, that's quite annoying to be seen as anti-cycling. But actually there are some real challenges for each site. We're very accessible by car, on foot, by public transport and by bike. But I think sometimes it's how we explain how accessible we are rather than necessarily just the physical infrastructure.
Thank you. I'm going to jump to Sue Martin, and hello Sue. As a freelance artist practitioner, much of my work is facilitated through the heritage sector. There's been clearly demonstrated again and again the positive impact on participants with poor mental health. But how do the panel think that we can reach a wider audience and engage with those on the fringes of poor health, but not necessarily diagnosed? That's a really good question. Welcome to anyone that's got any ideas on how we might answer that one or address it as a sector.
I think I would have really appreciated somebody in the health sector on the panel right now, because it's not my area of expertise. But I think Ruth Ann kind of definitely hit something, sparked something in my mind, which was about the language that we use for some of our programs, that people don't necessarily know that they need something. So don't brand it as something that they need, brand it as something that they just might want to enjoy participating in.
Yeah, absolutely. And I mean, I would say again, certainly for the freelancers community, it's extremely difficult for freelancers at the moment. And you know, COVID is hitting on everybody's mental health, and no less that community. I would suggest though that for the prescribed culture, we were very careful about safeguarding the programme 6, because what we were having there are students who are recognised, who were presenting with diagnosed mental health conditions. And it was very important to us that we were able to refer them back to the professional if things got difficult for them while they were on the programme. But the other options, all the other options of prescribed culture are all self-referral. So it's about what is a huge thing, and many of you on the call will know this, is a huge personal care call from the NHS and the health sector, that really as individuals we should be taking more and more responsibility about where we do preventative, so basically, you know, trying to stop ourselves getting ill in any way in the first instance. And I think that the heritage sector and the freelance community can do a lot to help that. I would be a little bit careful though of sort of banding the word well-being about a little bit too much. And there is also a distinct difference between well-being and difficult mental health. Those are two. Well-being tends to be a bit more prevention, and once you've got into a difficult mental health problem, you're looking more for early intervention. And again, the heritage sector can do something for both. One of the bits of research that I came across, which I think is really interesting, was around people who have a level of mental health difficulty not actually wanting to access the arts or sports. Now that takes away heritage and walking and sort of nature, but it was because when you have less well mental health, your confidence is lower, your self-esteem is lower. So you will assume that if your social prescriber suggests you join the local choir, you will wrongly assume that everyone in that choir will have more musical ability than you, or the people in the art club will have more drawing ability than you. Whereas it's very difficult to go, I'm an expert at heritage. You know, heritage is totally open. It's not a skill as such, even though we have a lot of knowledge and a lot of passion. It is very, very accessible. And I think we should shout a bit louder about the fact that you can't really sit at a dinner table and go, I've got a great talent in heritage. So I think we should use that more.
I'm going to do one last question before moving to the wrap up, and apologies for those whose questions won't be answered today, but we'll try and follow them up. And this is from Kathy Moore from Share Museums East, and has asked, Giles mentions participants from the health sector here. How can we get them more involved and part of the discussion? From a previous Cultural Heritage Wellbeing Alliance event on social prescribing, the NHS at local level seems nervous to get involved, or more accurately to support fund what might be temporary projects with no medium or long-term funding. His NHS prescribing culture and heritage funded non-pharmaceutical or CBT style solutions a long way off. And Ruth has just mentioned the local GP social prescribers. Are there any examples of heritage organisations working well with them? I'll just lead with our experience from our main office in Salisbury. And for me, this is all about relationship building. We've gone ourselves to the link workers and some of the primary care surgeries and establishing conversations with the link workers. And in some cases, there are lead doctors that seem to be GPs that are very, very proactive and keen. And it's through talking to them, engaging, as been mentioned earlier, with the local authorities. I think it's critical. They're very well connected. And there are efforts at the commissioning level, certainly within Wiltshire, to establish a framework of almost the support sector into the NHS, so that there's a better triangulation and coordination of efforts. But if there's any other points from Ruthann or Louise just in finishing?
I would sort of say that my own personal experience, I think maybe Edinburgh is really enlightened in this way, because I have to say that at the university, the university GPs, some of them are in health centres that are sort of part student, part community. And I do know that the GPs in the community half were slightly annoyed that they couldn't access this. And I mean, like I say, in my presentation, we had Dr. John Ennis and Dr. John Gillies, and the lead GP was Nina Talbot, and they were all incredibly passionate. Now, I will say that they all each said to me, we are absolutely are behind this. We will do anything you need, but we will not be attending your monthly steering group meetings. Please sort of use this basically like a phone a friend, line up all you need us to answer in 1 half-hour slot, maybe once every 3 months. I think we just have to be extremely mindful of the fact that they are extremely busy, under more pressure now than ever. So if you do start building that relationship, I would suggest that you really just touch base with them when you really have to. But they will really, my experience is they'll absolutely appreciate it. The GP who I worked with for prescribed culture basically said to me, look, don't worry about going out and finding stats that mean that prescribed culture meant the students turned up here less or anything like that. Just go and prove that it works, because she said, we have filled every other option to capacity and we are needing other options. And that's more or less what we did. So I think that's sort of keeping it nice and succinct is helpful.
Ruthann, thank you. Right. Can I say a big thank you to each of the panelists, Louise, Ruthann and Lizzie there. If I can go on to the next slide, please. In closing today's event, I'd like to thank everyone for attending and to say that the report is now live on the Heritage Alliance website. I hope all of you have a greater understanding of the important role heritage can play in supporting wellbeing, as well as recognising how exciting and meaningful wellbeing heritage projects can be. I'd urge you to really consider how you and your organisations can implement the recommendations in this report. And we want to keep this topic alive. I hope this has been a call for action to start to embed wellbeing considerations into your organisation's strategies. Please do share your experiences and best practice on Twitter using our hashtag #HeritageHealthWellbeing. The Heritage Alliance will be looking to support and pick up conversations on this project, and we're starting conversations with decision makers using this report as a catalyst. And final slide, please. And please do fill out our post-event survey so the Heritage Alliance can see what kind of work going forwards would help you to implement the recommendations of the report. Now, more than ever, it's vital for us to keep this conversation alive and learn from one another how to support those who need it most. The more connected our communities are, the better they will thrive. Thank you very much for attending today.
A huge thanks to Giles for chairing so ably as well for us all. Many thanks, Giles.
Thank you very much.